As essential businesses adjust their policies to combat COVID-19, doctors are still seeing patients who are suffering from other illnesses like cancer. But Texas Oncology has found an innovative way now to connect with their patients, and PJ Green is joining us to explain more.
Texas Oncology says that virtual appointments have been working very well for them and that federal and state legislation has kept them from doing this in the past. But now that the coronavirus has spread, policies have changed and have allowed them to treat patients from their home.
Policy change tends to be incremental, and I think that the administration wants to make sure that they're being as safe as possible with Medicare beneficiaries as they make decisions. But I'll say, I mean, it's a huge shout out to the administration and to CMS and Governor Abbott, because they have been incredibly progressive about telemedicine policy.
Telemedicine has been the primary way of appointments for Texas Oncology since the coronavirus outbreak, and doctors and patients appreciate the caution being taken as fears grow as the virus spreads.
It is one way that we can do things like shelter in place and still obtain the medical care that we need. So that's been really helpful. And I think that during this very challenging time, patients need to be interacting with their doctors.
And even though oncologists aren't therapists, they can still help their patients lower their anxiety.
Most of us aren't just okay. Most of us have heightened anxiety. Cancer survivors have a lot of anxiety because they may be at greater risk. They may have questions for their doctor. They may need to manage side effects of medications. So that interaction is really critical, and being able to maintain it has been so helpful.
And cancer survivor Stacy Bella Rose thinks these virtual appointments should help patients tremendously.
I was just at the oncology office about 2 weeks ago. And, we were all scared. We were all scared doing our little 6 feet apart. And as a survivor, you don't need to be out right now. You need to be at home as much as possible. So I think that's great news.
And Stacy has some tips on how to pass the time for survivors and patients who are currently battling cancer.
Reading good books are an awesome way to battle through cancer. Long hot showers is what I always like because my body hurts so bad.
Now, Stacy also says that connecting with family is another good way to pass the time while sheltering in place, and Dr. Patt advises patients to stay in touch with their doctor during this time.
Okay, PJ, thank you so much.